and she is the resource for holistic health and healing, and she specializes in education and therapeutic nutrition with the traditional Mediterranean diet. Welcome. How are you?
I'm very good. Thank you. Thanks for inviting me.
Yes, and we have Joanne Papric of LegalShield. How are you, Joanne?
Good, thank you. How are you?
Good. Tonight we're going to talk about a couple different subjects, and are you ready to go right into it, Dr. Artemis?
Yes, I am.
All right. Could you explain what is integrative medicine?
So, maybe before I do that, I could tell you why my credentials make me an expert in talking about what integrative medicine is, if that's okay.
Sure.
I'm the co-academic director of the Graduate Institute's Masters of Integrative Health and Healing with Dr. Bernie Siegel, and I also am a professor of nutrition at University of Bridgeport, and I studied naturopathic medicine. So it's a medical school that is a leader in integrative medicine, whereby it incorporates nutrition, herbal medicine, looking at the mind-body piece, and is a holistic approach to medicine. So, when I talk about what is integrative medicine, is coming from a place of my choosing to devote my life to this type of medicine. So I think is important because I know we've got a lot of choices out there.
And I had forgot you were located in Connecticut.
Mm-hmm.
For Connecticut. I wanted to say that. I forgot to say that. Mm-hmm. So what do you integrative medical approach to the the COVID-19 pandemic? What do you recommend?
Yeah. Well, let me explain a little bit more too about integrative medicine. It's really a system of medicine that looks beyond pharmaceuticals and surgery. It includes it because medicine includes, of course, pharmaceuticals and surgery, but it goes beyond that in the sense that you would also include looking at the cause, looking at preventative measures, which we're all very concerned about with COVID-19. A lot of us, are at a loss for what to do in terms of our home pharmacies. So the beautiful thing about integrative medicine is it looks at health and the human condition and all of the factors that tie into what makes us well and what affects our health. So, some of the concerns people out there may be having is, how do I eat to stay well? How do I deal with the stressors? How do I deal with the stressors, including financial stressors, including family stressors? And so in a integrative medical approach, the mind, the body, the spirit, your nutrition, using natural therapies is all part of what you can do to help prevent disease, to help heal disease, and incorporates a therapeutic order in terms of deciding, which of these might be appropriate for you at an individual point in time. So in particular with the COVID-19, if we look at it from a holistic perspective, the first question I ask is a tricky one, and I know there's a lot of information out there, is what's the cause? So if we look at what the cause is, and this is where I feel like I call myself a collaborative, integrative expert or professional, because I really think it's a conversation we all need to have. And it's a conversation that I don't have all the answers to, but I feel like if we talk about it, like we're doing here with other experts, with other people who have their own opinions, we can come up with something, a better sense of what the cause is, what we can do to prevent it. And when we look at causal factors, there are a couple of factors out there that are being researched. One is in particular, what is this viral strain? Why is it so dangerous? And you can go down the rabbit hole of many different theories there. And we, so I'm going to leave it up to other sites to help educate your audience on that.
What are the main questions? Like, do you get asked a lot? What does somebody ask you, do you find?
So another concern people have from an integrative perspective, because, as human beings, if we just were like machines and we all functioned, just on drugs and surgery, this wouldn't have happened. So if we had, we thought we did well with infectious disease, but we're not doing well with infectious disease, obviously. I thought that was like, okay, we got that. We don't have it. There's other factors, environmental factors being a major one. So one question I get asked is what do you think is going on? And I have my own theories. I just am trying to stay on top of the research as it's coming in, like everyone else. But I think we really need to look at the environmental impact that 5G would be having on our health and wellness. There are not a lot of studies on that. I don't know if it's a causal factor or if it's a coincidence, but I know a lot of professionals and integrative healthcare practitioners are looking at that as a factor. And what do we do? I know there's a movement to say, let's do a little more research before we go ahead and expose us all to this, because it is well known that even 4G has negative impact. So I have patients that I treat for fertility, and one of the things we look at from an integrative perspective is, where are you holding your cell phone? Because if you're holding it in your pocket all the time, it is having an impact. And you could even look at, what different telephone inserts say on that. So, from an
placing the phone just in their pockets. Wow.
Exactly. So there's all, there's the, what are we being exposed to on the environment from that perspective, that we are not aware of. It's also looking at, nature versus nurture from the perspective of this is a virus and we don't have a cure for the common cold. We don't have a cure for influenza. The vaccines are maybe 10 to 20% effective every year, if you look at different statistics. So where are we going with just looking at pharmaceuticals? We need to look at what do we need to do to promote the soil? How do we help our immune system? And so from an integrative perspective, you're looking at, of course, all of the pharmaceuticals, the potential therapeutics on all levels that are coming out, the clinical drug trials that are out there. But, you can't just look at that. We know that you can't just look at the body that way, because we have a microbiome. And a microbiome is like, we're actually 10 times more microorganisms, bacteria, fungi, including viruses, than we are our own human cells. So we can't just kill something and think we've got the problem solved. We know that with antibiotic resistance. So we really need to look at how are we supporting our immune system? And that's something that, I'm working on a newsletter, or I'm doing more research on it. I know there's a lot of things that we can do, and a lot of things that I've told my patients about, diet, nutrition, a lot of different foods we can have, not having a lot of sugar. When you're going to the grocery store, there's certain things that you want to keep in mind. Those fresh fruits and veggies, absolutely, that have high vitamin C and a form that is very bioavailable. So the fresh fruits and veggies in a bioavailable form, those berries, certain things should be organic, certain things don't have to be. You can look at the environmental working group for that. That you look at also what you don't want to be eating. This is not the time to pig out on your favorites. I mean, you could have some, because you want to keep some food in there that makes you a little happy, because emotions play a huge role here too. So that's the other factor. So there's diet, nutrition, and in naturopathic medical schools, we are the only general practice trained medical education that includes nutrition throughout our 4 years of medical school. So that's why I went that route. Because growing up in a Mediterranean household where food was always medicine, including squid, which was not my favorite or my sister's favorites.
That's about it. I ate that over there.
A lot of onions in there. Not my favorite yet. Still not my favorite. But food was always, our primary medicine. And this, before we had pharmaceuticals, food was medicine because you didn't have a choice. Now we have a choice. So we can, pick, the right pharmaceutical along with the right foods, along with the right choices in terms of lifestyle, in terms of exercise, stress reduction, looking at all the factors that affect our health. But just to, quickly go down, what can you do from an integrative medical perspective for COVID-19? You can look at, what foods you're eating. And we can do a whole another segment on that if you like, looking at diet, nutrition. We could look at what herbs and what medicines, what natural medicines are possible. Some of them you may have in your kitchen, like cinnamon or ginger. So we can also look at, from a mind-body medicine perspective, what kinds of stress reducers are you going to have, exercise. And I know Joanne's going to talk to us about our financial health, because right now, I'm in there with everyone else. We're quarantined. We might have, doing Google Classroom. We've got, there's a lot going on. There's a lot of stressors.
I had a question for you, and like with all the parents, with all the kids home now, like even my son, what do you recommend for kids? I mean, you're even like for I know the sweets, but let me tell you, they're running around the house all day long, and I can imagine, when you have 2 or 3 of them running around. Is there stuff that you can recommend for children, or it's the same? Basically?
Yes. I mean, this is a perfect time to go more towards a plant-based Mediterranean diet for the kids too, because you can actually use food as a way, as part of an educational system. And in many nutritionists can, do this as part of, if you do a part of Mediterranean diet, experimenting, like try this blueberry, then try this raspberry, and try this vegetable, try it raw. We can play with food. So this is where kids get to play with food. This is a great time for that. The other day my kids were watching a show online, and they had someone who was making an app, like eat this onion and pretend it's an apple. It was very fascinating. It's like mind games for kids or something, but we had some raw onion, and that's what my mom grew up on. And I know Joanne's, ancestry is from the same place there in the Mediterranean, where, this is a time where I feel so blessed to go back to my roots, and to know that my mom survived World War II, was in the Mediterranean. My father was a World War II vet, and, survived the Depression. Like, what did they do to survive that? And this is one of the assignments my kids had. How do you deal with adversity? How do you interview someone who dealt with it? Well, if you've survived a war, then you really know. And we're going through our own personal war,
right now, definitely.
Yeah.
So for the kids, it's like, play games, get creative, play with your food, introduce them to new foods, have them be a part of the process, cook with them, and now, you don't want to just grab a bag of some processed food and put them in front of a TV. Now is like, after we do all our work, and I know this is the challenge, I know for me too, is like, how do I do my work?
Right.
And still take care of the kids. But you can involve them in the process, in understanding a better sense of what food is. Exercise. I got roller skates, so we're roller skating out there, so I think there's a lot of options.
I got rollerblades. We've been doing that.
Oh, now I know my wife's watching. She's going to be like, trust me, she's going to be telling me the same thing. I've told you this about the eating of processed foods, and making it. And I know she's watching right now, and she's saying, David, you better pay attention to this, but that's a lot of great information. So I'm going to go out and get some rollerblades. If you would like to introduce, Joanne, and talk to Joanne.
Yes. Yeah, I'm so glad Joanne is on the call, and thank you again, David, for inviting me, because, right now we could talk about diet, we could talk about nutrition, getting enough sleep, a lot of the integrative medicine, mind, body medicine, meditation, yoga, exercise. But, one thing that we're all facing is financial stress. And so I've been blessed to know Joanne for a while. I did just get LegalShield and ID Shield myself, because what do we need to do to protect ourselves? And it's really an important part of, budgeting for healthcare and knowing what to do. So, Joanne, this is your area. I'm all ears.
Well, first I want to say, Artemis, it's always so great hearing you talk. It's amazing. I love hearing you talk about nutrition and alternative medicine and all that stuff. I love it. It's a fresh.
It's interesting, it is.
Yeah, it was just great hearing all that stuff. with what I do is I help people protect their finances, not so much help them with their finance, but protect it with identity theft. So it's an umbrella of protection that unfortunately today, every 2 seconds, there's an identity theft issue happening to somebody. The victims are right now the top victims, and I spoke to this in past videos, that the victims are children, but right now the victims are all of us, because guess what? What are we all waiting for? We're all waiting for this money that we're told we're going to get, because we're all home. We all had to stay home from work. We're all, businesses are losing income, employees, employers, all around. And what's happening right now, and it just happened to somebody that I know up close and personal in New Jersey. They got a phone call yesterday, and they told them that they have their money for them, and they asked if they had information to give them. They needed their social security and their date of birth in order to give them their money, and they even called speaking their language. So they know so much about you. They know what your background. They already have everything they pretty much need. But once you give them your social security number, that is it. They now have your identity, and they're going to use it and commit fraud.
Well, there really shouldn't be anybody calling you, right? I mean, there's nobody like from the government.
You're not going to receive any phone calls. They're not going to be calling you. They're not, and they're definitely not going to ask you for your information. And they want you to pay. That they're asking also for you to pay a fee to get your money. They would not be doing that.
So even on all the email scams, I'm sure.
Yeah. And I mean, this is all coming from the Federal Trade Commission. So also, if anybody, feel free just to go onto the Federal Trade Commission website, and you can find out ways of preventing scams from happening. Just not preventing, but basically protecting yourself when you do come across it. And the other thing that I wanted to emphasize on with every 2 seconds of somebody, becoming a new victim of identity theft, it can cost you over $1,000 just to restore your identity. And that is like the minimum. What I've seen, it has cost people a lot of money. It has cost them their job. It's a 30, 40-hour work week to restore your identity. So, and it's hard with all the people in the bureaus that you have to call and just to prove. And then sometimes you need a lawyer because you're guilty until proven innocent when it comes to identity theft. So it's not you're innocent until proven guilty, right? That's how we usually know it as. So again, protect yourself just like we protect ourselves in every other way with alarms, like I tell people, and we lock our doors. We have to protect our health, right, by eating well, and taking the right precautions. We need to do that right now. It's the era we're in. It's unfortunate, but it's the era we're living in, and I think it's imperative that we protect our identity.
And what I've learned in a group last night that we spoke about is, I leave it to the experts now. Like even for unemployment, like with staffing, I direct them to the facility. I don't want to give out the false information because that's what happened to myself. I should have listened to the experts. But on social media, everybody posts so many different things and you don't really know what to believe. So I try to gear it back to the proper people that would understand it, because I don't want to put false information out there for myself.
No, I'm in the arena, and because I'm in the arena of this, so I hear all the stories. I get all the phone calls. I get all the emails of what's happening right now and what's, going on. I got the information. I got from, FTC. So this is something that I'm always looking at. I'm aware of, and anybody can easily just even go on YouTube and look at identity theft issues. And if you see videos on what's happening to children and the elderly and just what people are going through, one woman got arrested 8 times because of somebody committing crime in her name. And every time she got pulled over, something happened, a red flag came up and they arrested her in front of her children. She was a nurse. Another woman was a stay-at-home mom for about 5 years. And she decided to go back to work. And in those 5 years, somebody was using her Social Security, working under her name. She couldn't get a job. She had to hire lawyers to fix her identity and they had to find out who this person was. And because she was owing money in taxes. And she wasn't even working. So it's a very unfortunate and scary situation. And I think that people need to, we all know somebody. We all know somebody that experience. It's 1 out of every 2 people, every 2 seconds. It's very scary, and we need to protect ourselves.
All right. Dr. Artemis, in 30 seconds, what would you recommend in 30 seconds? And we'll wrap it up. And what do you recommend?
So I recommend being aware of what your stressors are, reaching out to friends and family, because support has a wonderful effect on your immune system. We can't touch them, but we can hear from them. We can talk to them. We can do acts of kindness from afar. Eating good quality food, mostly plants, getting fresh food, sleeping, and also thinking about, spiritual meditation, exercise, anything that makes you happy. That's good for you and good for your family. And, if someone wanted specific recommendations, I am doing consults on the phone.
Okay. And how would they get what's the best way to get a hold of you that you recommend?
The best way is, so there's 2 websites. I have Dr.Artemis.com, where I have supplements that are for, immune support that I direct towards my patients. And then I also have ArtemisWellnessCenter.com. That's where you can schedule, you can call the phone number, you can email info@ArtemisWellnessCenter.com.
Okay.
And I'm really working on making as many resources available to the public as possible.
All right. I want to thank both of you, seriously, for your time. And, this is my 4th show. So, you just try to get all the information out there, and I really appreciate it. And I know we're all going to get back together next week and come up with like a part 2, and I'm looking forward to that. So thank you. And we'll be talking to everybody soon.
Thank you. Have a nice night. Good night, everyone.
Thank you.
Good night.